All right. So for to honor everyone's time that's here today, it is noon. So we're going to go ahead and get started. I just wanted to go over a couple of housekeeping items and then we will get started with our speakers today. We're really excited for today's session. So let's get going. So just a couple of housekeeping things. This is a safe place to ask questions, so please feel free to use the chat feature or to raise your hand if you have questions. We really want this to be a dialogue. Also, if you could, please keep yourself on mute unless you are speaking. If you are having lunch, feel free to turn off your camera, no worries there. Also, this session is being recorded, and we will also do our best to provide any resources that were offered in today's advocacy session. Also, we can use a lot of jargon. We've worked in this community for a long time. I know a lot of us have. And so if we strive really hard at recovery people, and I know at Texas Health and Human Services to make things as clear and transparent as we possibly can. So if we are using words or terminology, you know how we like our acronyms, then please let us know. And we are more than happy to discuss those with you guys. Also, we are offering CEs for this session. We will drop a link in the chat for you to sign in. Please sign in if you're in attendance, but you are required to sign in if you would like CEs for this session. A survey link will be put in the chat at the end of this session, and we need you to finish those surveys by 5 o'clock this afternoon. The only time you will get the link to the survey is at the end of this session. So please make sure to get those filled out. We will get certificates sent no later than October 31st. We appreciate your patience with that. And unfortunately, if you do not sign in or you do not take the survey, TCB rules prevent any type of exception to that. So please make sure that you sign in and take the survey. Without further ado, I would like to introduce you guys to our speakers today. We have heard so much from our community about, questions around certification and, all the things that come with that. And we are really fortunate to work alongside such amazing people. Felicia Mason-Edwards, she is the Workforce Development Manager in Peer Support and Recovery, and Bob Sepulveda is a Program Specialist in that same unit. And we are very grateful to have you guys here today and are looking forward to just learning as much as we can. And I will pass it along to you guys.
Well, good afternoon, everyone. And thank y'all to Elizabeth and Chelsea for inviting us on the call. We love it when we can just meet with folks and then hear all the questions that y'all have, because I'm sure it's a ton. So don't be shy. We're okay. We may rattle a lot of stuff off. Again, like was already said, stop us. You can stop us in the middle and say, hey, Felicia, I don't understand what that means. It is perfectly okay. But I will introduce myself and then let Bob introduce himself, and then we'll get started. Hopefully we can share our screen because we do have a PowerPoint presentation to share with you all. But my name is Felicia Mason-Edwards. As mentioned, I am the Workforce Development Manager. My background is family peer services. So I have a daughter with mental health diagnosis that I've had to navigate several services on behalf of her and all of the things that we do. So I have a lot of history with the certified family partners, but just really overseeing our kind of scope of work is overseeing curriculum development and training, workforce development issues, all related around peer spaces, as well as stakeholder engagement. So that is kind of the big scope that we oversee. And then we've also added a new program called Transformational Leadership. So really having opportunities for peers to become leaders. We think that you're already leaders, but sometimes there's different skill sets that people want to learn to advance either themselves or their career. We want to make sure that we're providing that opportunity for you as well. So I will pass it to Bob.
Thanks, Felicia. Thanks, Elizabeth. Hey, everyone. I'm Bob Sepulveda. I'm our program specialist on the peer support and recovery team. And along with Felicia, I'm in the workforce development section. And before coming to HHSC, I was a programs manager at a recovery community organization, Communities for Recovery. And I was a peer specialist there. I'm a person in recovery from substance use. And I believe that's it. Glad to be here. And also, can you see my screen okay? Or can you see the
Yep,
share?
we can see it. Awesome. You can go down. So most of y'all may know about a little bit of our history, and even how our unit was created, but we'll kind of talk a little bit through that. This is kind of what we'll talk about. Obviously, we did introductions, but really just talk about like the behavioral health services, what our unit does, what we do, how we operate, what the peer model is, what the role is, what the workers look like in Texas, and we call them peer workers specifically. We do not call them paraprofessionals because you are a professional. We don't know what para means. So I do know what para means, but we want this field to be professional. And so we will call them peer workers for this particular presentation, and then we will have time for questions and answers. But again, please feel free to put your questions in the chat as we are talking, because something may come up and you may not remember it for later. So our unit actually came out as a part of legislation, like many things that happen in Texas. So some of you might have been a part of this, and some of you guys may have even been advocating down at the Capitol for this particular legislation. So House Bill 1486 in 2017 really authorized the creation of a peer services Medicaid benefit. So typically what that means is folks advocated, or somebody advocated, people in the community advocated and said, you know what, we really want to have a way to build peer services, because people can provide peer services anywhere, everywhere, and many people do. But they wanted to kind of have a standardized way for a fee payment structure, right? So in order to do that, you have to have somebody help implement that. So really that was the impetus for creating a team at Texas Health and Human Services to really say, okay, now that this benefit is created, we got to have some kind of like structure behind it. So that means that we had to create what we call the Texas Administrative Code, so the TAC rule and the TAC language. And so sometimes that can be difficult. And we say sometimes people love that to have like, hey, we got this benefit. But then there's some other stuff that also happens when you have a benefit. There's rules and regulations behind that as well. So we're just excited that we created an actual team. Not many states have a peer team within their health and human services. We are one of very few. And so we have a team of 7, and our job really is to figure out what we can do to help support people within the peer space. Our vision, we created a team vision and we created a team mission. And our vision is very simple. We want a Texas where anybody, regardless of where you are in Texas, can access peer and recovery support to achieve their ideal quality of life. And again, we say their ideal quality of life. That does not mean the clinician's idea of quality of life for the individual. We are very clear when we say we want you to live your best life, whatever that means for you. That is what peer support is about, is supporting people on their journey. Our mission is to support, strengthen, and enhance the peer workforce and recovery services. Right now, we are super excited that we get to just be a part of the workforce, right? The peer workforce is an emerging thing that now everybody wants a peer. It's kind of like we're the greatest thing since sliced bread. You know how it kind of comes around every couple of years. You'll get one industry that's like, hey, we want a whole bunch of social workers, and that's the highlight. Well, now peers are the highlight, which is great. It's great to have to be highlighted, but it also comes with some responsibility and some questions around what does that mean? Because our goal is to have peers wherever there are people. We want peers. And so not just in the behavioral health setting, we want peers in Walmart, in Sam's Club, in wherever, you know what I mean? Wherever families are, wherever people are, we want peers to be available, because guess what? All of those places, McDonald's, Starbucks, that's where life happens too, right? So that is our goal, is to, again, have people have access everywhere. Next slide, Bob. So what is recovery? So we really hone in on the SAMHSA's definition of recovery, and SAMHSA is the Substance Abuse and Mental Health Services Administration. Again, I'm catching myself with the acronyms because we do say it so many times. We're just like, oh, SAMHSA. It's like, what does that mean? That's the big federal government entity that's really talking about recovery. And right now, really, they are doing a lot of wonderful things to highlight recovery. So SAMHSA's definition is recovery is a process of change through which people do a couple of things: improve their health and wellness, live self-directed lives, and again, strive to reach their full potential. Again, our goal is not ever to dictate to anybody what their full potential is. that is the individual's the voice and choice. It's their self-directed life. Thank you, Bob. Yay, we lose the circle screen on here. We want folks to live their version of their self-directed life. And again, our role is just to help support that individual in their journey as they're reaching their full potential. Again, live their greatest life as possible. So again, that is the definition that we do subscribe to and we adhere to, is to make sure that everybody kind of understands what we mean when we talk about recovery, because recovery can be really big. Just like even peers now, it can be really big. There's many definitions out there. So we do want to be very clear about which definition we use. Next slide. All right, so what is the peer support model? So there's lots of people tend to have questions around this particular, like what exactly is peer support versus just a friend talking to somebody, or, what does that look like? So here's kind of what we defined as the peer support model here in Texas. So peer support is really when somebody with lived experience just really gives assistance and encouragement. Most of you guys have heard people say, like, we offer hope to people, like that. We're like the hope dealer. We understand stuff happens in life. And again, based on our lived experience, we just talk with people and give them encouragement. We also offer all sorts of other supports, like emotional support. We share our knowledge. We may share resources, whatever individuals may be wanting help with, right? So we just kind of give them kind of what we know, and then kind of can help or assist. Again, they are the person that has self-direction, so we're not forcing anybody to do anything. It is totally voluntary, but we just give them just assistance and connect to resources and community agencies, right? This is an evidence-based practice, so we're very, very glad that there is data behind this. So we know that when people are offered peer support, their lives seem to be improved, right? Like it gets better. And so that's our goal, is to really also have data aligned with a lot of the work that we do, because we know peer support works. Many of us have had peer support in our lives. I know I've had peer support in my life, and it's been wonderful. It's very different than talking to a clinician. So it's a great opportunity to make sure that the data is aligning with the support services that people are offering, so we can continue to advocate for more resources in the peer space. Sometimes I tell people that when you're talking about like advocacy, because I know that's a really big thing also with peer support as well, is we want to make sure that peers are also advocating at many different levels, whether you're advocating within your job, or you're advocating at the legislator level, or even the federal level. Because we know that peer support works, but sometimes other people don't know. And so there's a way to have that advocacy as well, to let them know that, hey, this stuff works. And we want to make sure that we're offering various different things and people are learning kind of around the peer support space. Next slide, Bob. We always say we want to be clear of what it's not, right? So we want to tell you what it is, but we also want to tell you what it is not. We are not the authority on anything at all. We know our life, we know our lived experience, but we do not dictate that to anybody. We don't offer diagnosis. Nope, not at all. And I am my background is I am a clinician, but I do not do that because my role is the role of a family peer. So I don't do any of that at all. But it's, everything that we do is really about, just helping people as they go through the journey. So we don't have a single pathway to recovery. We believe that there's a spectrum from abstinence all the way to harm reduction, and there's a whole lot of stuff in between. So we are not the subscriber of that, any particular, with whatever the individual wants as a part of their journey. And we are not what I call the snitches or the monitor of the compliance of use or non-use. We don't go and run back and tell and be like, oh, guess what? So-and-so is not on their medication. That is not our role at all. We do assist people if they are having issues if they're saying, hey, I don't like this medication. We want to help them advocate and say, hey, have you talked to your doctor or whatever? And you're saying that you're like, but we are not the one to run back to the doctor and say, well, guess what? Johnny just told me, he's not taking his meds. That is not our role. And so I always say snitches get stitches. And so we don't want to be a part of that at all. Again, the individual has their voice and it's their choice, and they can talk to their doctor if they need to. So that is what we are not, folks. And so next slide. So really what the role is, what we see as the peers is we are very critical and we feel a need. We say, see a need, feel a need. That's what we do. Again, we're not clinicians, we're not that, but we have that mutuality with individuals. Again, based on our lived experience, we can share that journey, we can share that hope, we can, say, sometimes it may not be a fun day today, but hopefully tomorrow looks better. Again, always being what we call the hope dealer, just being an inspiration to people. We do a whole lot of role modeling. We role model what recovery looks like. This is what, it looks like. And sometimes, and we're honest, there's some days I don't feel well. Like today, I do not feel well. I have sinuses. So if you can tell, my nasal congestion is horrific. But we can also be honest and say, I'm having kind of a little rough day too, but that's okay. I'm going to push through and I'm going to make it through. And again, we can share that hope, but also share sometimes the reality is it's okay not to have a great day every day. It is okay. We don't have to always be sunshine and roses. The goal is just not to stay there, right? And then we just support folks as we're talking about their person-centered recovery planning. And again, we want it to be strength-based. We want it to be their plan, whatever their plan is for their life. And so we do a lot of, again, as we said earlier, just a lot of resource sharing, a lot of knowledge sharing. We offer, all sorts of stuff. It's a great time to be a peer because we're like the coolest people on the planet, I think. Peers are just cool. We just do stuff differently. But again, our goal is to support individuals as they're walking through their journey. Next slide. So here's just the number of the peers that we oversee in Texas. So currently we have 5 different peer certifications. One is the mental health peer services or peer specialist. Then we have the recovery support peer specialist. We also have, the one I am is the certified family partner. And then we have reentry or justice involved. Some people call it that way. And then we have just the peer specialist supervisor. So those are all of the certifications that are currently recognized in the state of Texas by the Texas Certification Board. So we do not have any others outside of that. I do know that we have been looking at several different other models. So for example, we've been thinking about how do we get a substance use version to the family side? So that is something that we've kind of been investing in. We're also looking at various endorsements. So endorsements typically is what we see is that I am already certified in something, but I want a specialization in something. So for example, we have the youth and young adult peer support that will be coming out hopefully the beginning of the year. It is getting revised currently. And so that would be considered an endorsement. So if you're already at MHPS or RSPS, then you can say, hey, I want that specialization. Other things that I know that people have been asking us for is older adult peer support. So we're looking at ways to see if there's curriculums out there already. We've been talking to people about that as well. So these are our 5 core certifications, but again, that may change depending on what we're hearing from you all, our stakeholders. So we want to make sure that we are listening to you all and meeting the needs that you all have. And then next slide, and I think I'm going to turn it to you, Bob.
Thanks, Felicia. One thing about this, about the peer certifications in 2021, we had 800 and some odd peer specialists certified, including supervisors and family partners. And in 2023, we're double that. We're like in 1,600, 1,700. And in comparison, addictions counselors number in the thousands and social workers number in the tens of thousands. So there's been a lot of growth and it continues to be so, but there's still a huge need. So like Felicia mentioned, in Texas, there's a set of statutory guidelines. There's rules for how peer support services are provided, and it's defined in Texas Administrative Code as a peer specialist is a person who uses lived experience in addition to skills learned in formal training and to deliver strength-based, person-centered services to promote recipients' recovery and resiliency. And the code includes the scope of services, the ethical standards, definitions, training, and certifications. So services may include recovery and wellness support, mentoring, and advocacy. They can be provided individually or in a group setting. So some examples are providing information and support on planning for recovery, serving as a role model, providing assistance in finding community resources and services, providing support in stressful and urgent situations, and helping to ensure that a recipient's rights are respected. All services are recovery-oriented, person-centered, relationship-focused, and trauma-informed, and always voluntary. But there's often questions about what are the specifics of that, right? What are some of the tasks? What are some of the duties that can be performed under mentoring or advocacy or recovery planning and so forth? More details can be found in the SAMHSA core competencies for peer workers. Another source is the ICNRC Candidate Guide for Peer Recovery, the NAPS National Practice Guidelines, and also there's a new technical assistance protocol for peer support workers in substance use treatment settings that's got a lot of more detailed information about what sorts of duties fall under those categories. There's rules in Texas Administrative Code for certified family partners, but they're in a different section than the Medicaid rule section for substance use and mental health peer specialists. These are the steps to become certified as a peer specialist. They're listed on our webpage, right? Certification for peer support, and they must be completed in order. So for step one, sign a form attesting that you meet the qualifications, that you've read the orientation. It's located at the bottom of the page. A lot of times I get the question, where's the attestation? I know I'm supposed to do some attestation, and basically it's just a signature. The whole page is the self-assessment and orientation, and the attestation is confirming, you're just saying you took all of that. And it's going to be, the process is going to be changed, but for now, that's where it exists. So you apply for training with a certified training entity, and you can find the training entity from the list of on the Texas Certification Board's website, or you can go to PeerForce and they can help you with that. And they've got a calendar and a whole area listing training resources. Complete the core and supplemental training and complete a background check. And then apply for a 6-month certification. Complete the 250 hours of supervised work experience and then receive your 2-year certification. Now you'll notice there's an asterisk there, right? That we have a provisional credential available for some, meaning if you don't pass a background check, there's a provisional credential available, and I'll detail that in just a moment.
Hey, Bob, a real quick question. You're just about to answer it. Never mind.
Oh, go ahead, though. What is the question?
My question was going to be, how long is the training, and if it all has to be done in one setting?
Yeah, well, we just revised the core training, so I don't recall if it's gone up from 6 hours. I think so. Felicia, it's gone up, right?
It's 3 days. So yes,
Yeah.
the core training is the 3-day training. So it's more like, I think it's a little over 16. Now I'm getting confused. 16. I'm gonna find it before the end of this thing is done, because I think it's like 16 or so hours. It's kind of broken up, but I'm gonna double check.
Okay, thanks. Yeah, I just noticed that. All right, and then take a 46-hour supplemental training. So the supplemental training is the specialized training, right? The core training is the same for everyone. The supplemental training is your specialty area based on your lived experience. So if you're a family partner, you go to the family partner training. If you're a mental health peer specialist, you're going to go take that one. Or substance use peer specialist like myself, you would go and take the RSPS training. Then you do a 250-hour internship. That's considered training, right? And it has to be supervised or co-supervised by a certified peer specialist supervisor. And so the curriculum's composed of content based on the service provision standards in Texas Administrative Code, aligned, of course, with the national standards, core competencies, and all of that, as well as the peer specialist code of ethics. The core curriculum focuses on the values, principles, rules, and competencies common to peer services in general, as well as an overview of the distinctions between the different specializations. And let's see. All right, so background checks, right? Everyone has to take a background check. Well, the mental health peer specialist and the recovery support peer specialist have to take a background check. And certification can be denied for offenses related to the duties and responsibilities of a peer specialist. But the period of denial is different based on the severity of the charge, right? And those charges are categorized on a scale from 1 to 5, 1 being the most severe, 5 being the least severe. And the range is from 3 years to a lifetime. The details and scale of offenses are located in Texas Administrative Code, right? That there's a section about that. And then there's also a table, right? There's a link with a table that opens up and shows the scale. And there's also an appeals and exceptions process for applicants that are denied certification. Exceptions are possible for extraordinary or extenuating circumstances. And there's also a provisional or intern credential for applicants who are not able to meet the background check qualifications. So here it's important to understand the difference between the initial certification, which starts with an I, and the intern credential, which starts with an I. They're both, unfortunately, kind of real similar and get confused or conflated all the time, right? I think the way they list the endorsement on the certification is -I for initial, and then -intern for intern. And the intern is the provisional credential. So if you got some charges and it's going to be a little while before it rolls off or something, and you qualify for the intern credential, you'll be issued that when you apply for it. If you get that intern credential, you still have to do the 250 hours in this, by the same rules or in the same amount of time. And also once you still have to renew it, you still have to get all the CEUs the same way you would do with the Medicaid billable credential. The intern credential is not Medicaid billable, right? You can't bill Medicaid with that one. So those are the sort of differences there.
I have 2 questions. So the first question is about the 250-hour internship. So will one internship cover both specializations, or will you have to do a separate internship for each one? Like one for the mental health and then one for the substance use?
That's a great question, because it's often asked. I've even been confused about it at one time or another, but one time covers both.
Okay. And then
that's
I'm
that's
sorry.
actually one of the things that is in Texas Administrative Code. It's just kind of in an odd spot, so people don't see it a lot of times.
Okay. And then my second question is about the criminal history. So at one time, I was in communication with PCBAP, and there was something about a criminal history exception that could be, you can apply for. So is this what you're talking about? Or like, is that something that still applies? Where
Yes.
you can, after 3 years, I guess, because I guess I had a 5-year waiting period between my charges. And then you get the 3 letters, the new background check, and then you're eligible to go start your internship. If it's approved.
There's a process, right? There's a process to appeal for an exception. So essentially, yes. In the details, I'd have to kind of look up a little bit, but if you don't pass a background check and you want to appeal that, you can appeal.
Okay, so it basically would be an appeal, not just like
Apply for exceptions, excuse me.
applying for an exception. Okay.
Yeah.
Bob, is that Is that information you could share with me? So we could put it up on our website so
Yes.
people can find where that is.
I can follow up with.
Yeah, and I
Excellent.
found the answer to the question, because I was gonna say, I was like, no, it's not 16. I know, because that's 2 days. So it's technically 19.5 hours of content instruction. But most of the times it's in a 3-day format, which is an 8-hour day, because they have 1 hour for lunch breaks on those 3 days, and then they provide a 30-minute window for breaks in between. So typically it'll look like 24 hours technically, right, for the whole training. But that's including lunch break, an hour, and then 30 minutes of breaks in between. So technically it's 19.5 instruction period time, but listed as 24 hours.
So the new core training is longer.
Real quick, Bob, Felicia, looks like Rhonda has a question.
Yes, I wanted to ask, you said if we had a question, I'm sorry, that there was some chat place or somewhere to post a question, but I don't see like a chat or place to ask a question. I wanted to know, is there some, I guess, a workforce community where you can look for individuals if you're looking for peer support personnel for your organization? Is there some warehouse, or you understand what I'm saying? A place where you can go to find those professionals. Is there something like that available?
Rhonda, that's a great question. And I too couldn't locate the chat. I was thinking it was just me. and so, yeah. Chelsea, we're going to say something?
Yeah, real quick, everyone. If you, it doesn't look like the chat function shows up on mine either. I have to hit more, the 3 dots at the bottom, the ellipses. If you hit more, it should show chat. Is that for everyone?
No,
No, yeah.
No, I don't have
see
more either.
I don't have more. That might just be for a host. I don't see it.
Well, even
Well, I did a Zoom upgrade yesterday, so I will check my
Maybe.
settings. Thank you guys for letting me know that.
I guess while we're mentioning these types of little details, when you check the settings, Elizabeth, can you go back to the accessibility settings and make sure captions are enabled for future Zoom meetings?
Absolutely. They were originally enabled for this, so I'm not sure what's happening, but yes, I will absolutely double check that.
It's a quirky Zoom thing. Thank you.
Did
so the
anybody?
other,
Oh, thank you. Okay, go ahead.
as for Rhonda, the other question, there isn't a formal community or clearinghouse like that, but if you go to PeerForce, right, they might be able to help you and assist you. They also have a map on there of organizations that provide peer services for employees, I think, so that you can look to possibly, I forget exactly what the purpose is, but they've got a really cool map on there that you can look that up. And then there's some informal, I think, social media groups, like
Okay, all right.
That-
Thank you.
and on Recovery to Practice and on Texas Peer Specialists, and I think PeerForce has one too.
Okay, all right. Thank you.
I would also say if you
Great
want, like if you were looking for peers, or if you have job postings, PeerForce has the job posting website, but you can also forward that information to us. We have monthly peer calls every second Thursday of the month, and so that is a way to share information. So if you are looking for folks and you know folks, typically we have anywhere from 25 to 75 people on the call, and then that's something we can also share with our peer D list as well. So we share out opportunities like that quite a few times.
Okay, that's also good to know. Okay, thank you.
All right, so sometimes peer specialists would like to work independently. The peer services Medicaid benefit was not set up as a provider type, right? So it was defined to provide peer specialists and peer support services in conjunction with a facility, provider group, or a community center or something like that. Peer support services are designed to be billed through that organization, and peers are not separately enrolled in Medicaid as a Medicaid provider, nor can they be separately credentialed by a managed care organization. Yeah, so MCO credentialing will be for the organization in which the peer is employed. Peer support workers practice in a range of settings: peer-run organizations, recovery community centers, recovery residences, drug courts, jails, other criminal justice settings, hospital emergency departments, child welfare agencies, homeless shelters, behavioral health and primary care settings. There's probably some that I left off the list. And notice that some of those are integrated settings, right? Settings where peer support is offered alongside other primary services. Services. All right. And so there's a lot of factors to consider when integrating peer support in a program. It's important to contemplate organizational readiness, buy-in from organizational leadership and community stakeholders, understanding the culture of your organization and where to help shift that culture if necessary, obtaining funding to sustain the peer position, recruitment of qualified peers, and support for help with recruitment and retention.
And Bob, I just want to park it there for a little bit, because this is probably where we see some of the most complaints from peers. Is typically when they get to an organization and the organization wasn't ready for them. And so then they get treated like they are other and not part of the team of the organization that they got hired for. And so we think that this is just really, really important that, everybody says, well, we want peers on our staff and we want peers in our organization. And that's great. And it sounds great in theory, that because again, our goal is to get peers everywhere. Like, we want peers in every single setting, regardless of what it is, not just in behavioral health settings, right? And so unfortunately, in order to do that, is that you have to be ready as an organization for peers, especially organizations who have no clue of what a peer does, because oftentimes that's where the peer drift happens, is that their expectation of peer role versus the expectation of what is outlined in the TAC rule and in the Texas Administration Code could be very, very different expectations, right? We've heard in some areas where peers are doing assessments. That is not something that peers would normally do. That is kind of outside of our scope. And so we just want to be very cognizant of, if people want to have peers, we're excited for that. But we also want to help support organizations in that journey as they are learning how to understand the role of a peer. So they're just not out there asking people to do various stuff. Or we've heard of peers being more like the receptionist than actually providing peer support. And sometimes that takes a culture shift within an organization to get ready for peers, to make sure that they're ready for peers. And again, it takes a different set and a team mindset to say, hey, peers are a part of the team. They are not just a separate entity over here, to the side. No, we want them part of the whole team, because they provide a lot of insight and information. So I just wanted to park it there for a little bit, because again, this is where we hear a lot of complaints from peers, is that, hey, this organization really wanted peers, but when I got there, I didn't feel supported. They didn't know what I was supposed to do. They put me in a broom closet. They had me taking temperature checks or making coffee, and that was it. So that isn't what we want to happen. And I see, Chandra, I see your hand up.
Yes, thank you so much, Felicia. Is it possible to go back to that last slide so I can refer to it? So I just wanted to offer another way to look at this slide, and what you're discussing is the peer workforce ready to is the peer workforce ready for deaf and hard of hearing peers? So this is a topic that I know y'all are probably tired of hearing me talk about, but I'm going to keep talking about it because it needs to be talked about. Do we have buy-in from organizational leadership and community stakeholders? Are we doing what we need to do to make our trainings, our webinars, and our workforce accessible? Understanding the culture of the organization and the deaf and hard of hearing community culture, right? And how can those cultures blend together and work together? obtaining funding to sustain peer positions. So deaf and hard of hearing peers can be welcome into the workforce. And you know, the truth is that sometimes it costs more to pay for the interpreter that a peer may need than to actually pay the peers hourly wage. And so it makes it difficult for organizations to so-called justify hiring that peer when they could hire someone who's hearing and doesn't need that accommodation, right? But that's the truth. We have to be able to have those kind of conversations and find ways to work through those things. And can we recruit those peers? Well, we can't if we can't provide services in their language you know, make things accessible for people who are hard of hearing and then retain them. So I just really love the clarity that's on this slide, but just using it from like a slightly different angle because all these things are really pertinent. I'm actually going to take a picture of it really quick. Is this available to me? Can you, if I give you my email address, can you just send me like this whole thing?
Yeah, I think we can give it to Chelsea and them guys, and they can send it out as a to the whole group. Yeah,
she can do that.
We are totally with you.
We'll put it on the
you
website.
have helped us and opened up a whole nother world about the deaf and hard of hearing, and we're still advocating. So I can tell you, me and Bob are still advocating to make sure, how do we get this to the broader masses? One of the things that we've learned is that every organization has their own way of how they deal with it. And so there's not a standardized way or a standardized process, which we thought there was, because we're like, okay, well, we got the Disability Rights Act and we got all of these like legislative things. And it's like, well, but this organization doesn't fit on, and we're like, what in the world is happening? So we're still fighting for that to try to make sure that everybody has, you know, accessibility for anything that we put out as a state agency. So again, even if we don't, we want you to remind us and say, Felicia, not this one, y'all didn't do this one. Again, we're still trying to figure out ways to find funding specifically for that, because that's probably the hardest thing, is finding specific earmarked funding for these type of services. We know that even in our training, we have to make it, you know, accessible. So whoever's providing the training has to provide those services. But again, that could be challenging, whatever that may look like. So we're definitely trying to navigate those waters, and they get really, really dicey very quickly, because bottom line, it boils down to money. And so we're still advocating, and we're still looking behind the scenes to see what is happening and how we can funnel money. Unfortunately, we don't have any right now, but we're like, hey, we got to funnel services, something, and not just a phone line, which is what typically is our standardized.
That was a big thing though. The 988 services becoming available in ASL. So thank you for sending me that. But thank you guys for letting me take some of the time for the webinar. I appreciate it.
No, it's actually a privilege. Thank you, Chandra. I'm glad that you brought that up. Let's see. All right. So yeah.
There's another hand up. I think somebody had a hand up, or maybe they took it down.
Okay.
Did somebody else have a hand up? I'm sorry. Okay. If not, we'll move forward.
I did.
Okay.
My name is Johnny Montalvo. I'm actually a family partner in a rural community, and which is also, of course, a peer worker. But what I was going to say is that in this actual topic is that here families are having to make the decision of having to pay like a copay just to see me because it's not covered in we're the local mental health authority is where I work right now. When they come, everything's covered if they have Medicaid, except for me. And
okay,
if I get a 15-minute window, I'm sorry?
I said, then that is a problem. So we can definitely talk offline about that, because family partner services are automatically covered. So
exactly, that's what I thought. And for some reason, in the scope of things and the way that things are done here in this, I don't know, in the scope of the way things are here in my work here, for some reason it's not covered. And I have a 15-minute window to ask the parents if they would like to continue services with me. I have to let them know what their map is, and it's on a sliding scale. Some of them have to pay like $50. Some of them are as much as $211. But who really wants to? Who has that money? And just to
Right.
see me, like, come on, you know, when all the other services are free.
Yes.
So I'm not understanding that.
Oh, I'm not understanding it either. And definitely it should not be the case. Those services are in alignment with every other service. So definitely we will leave our contact information, and I will reach out to your center to figure out what is going on. Because again, we
Yes.
don't want any barriers to services, especially services like family partner services that are just like peer service. Is free, it's voluntary, it's open to anyone. So yeah, please definitely we'll get your contact information, or if you get ours at the end of this slide, I'll try to, I don't see a chat on my thing either, else I put it in the chat, but definitely get our emails and we'll give the PowerPoint to you all. And if y'all again have specific questions, even if we're not able to answer the questions today for you today and you're thinking about it, I know sometimes it takes some time to process it. Like, wait a minute, I saw the presentation and now the questions are coming like a day or two later. It is okay. Bob and I, we have not only our personal emails, Bob has the peer email mailbox, and then I have the family partner email mailbox. So you can send us questions via that as well. So we totally understand, but definitely that one has got my ears burning right now. And so definitely want to make sure that we get that addressed so families are not coming out of pocket for services that are free.
We'll make sure to put y'all's contact information with the slides on the website, and we'll also be emailing everyone out the survey at the end of today. So no worries on that. We'll make sure to get everybody connected.
Yep, awesome. That's a big part of our role. That's what we're here for, to support you all. And that information, the contact information, our email address real quickly is bhs_peerservices@hhs.texas.gov. And it's going to be on the final slide. And if ever that later down the road, save that. If personnel changes, that one always stays the same. So let's see. Felicia talked about some of these challenges, right, for peer workers in integrated settings. That was a real world challenge right there that that Johnny brought up. And so some of these are role integrity, peer drift, ethics and boundary issues, stigma, lack of acceptance, like what Felicia was talking about, and job dissatisfaction and burnout. Those can be real huge issues. So one of the biggest antidotes for that is specialized peer supervision for peer workers, right? It's a vital component of peer support services integration, and peer specialist supervisors have been trained in the values, principles, competencies, and ethics of the role. We can assist with organization to understand and address the needs and best practices of peer integration. Many are experienced peer workers themselves. They can guide and direct workers in the scope, integrity, effectiveness, and satisfaction of the work. They can serve as powerful advocates for partners, benefactors, and the community at large for the benefits of peer support, and to troubleshoot ethical dilemmas and/or problems with the services like what was described. They're specially qualified to support the issues and challenges unique to peer support services integration. Let's see, our role focuses on the provision of service. Oh, the supervisor role focuses on the peer specialist provision of services, reviews of cases and activities. These are like direct support tasks like recovery and wellness support, mentoring, and advocacy. Peer specialist supervision should not focus on tasks that fall outside of the scope of work as described in this section. Okay, so review of cases and activities means cases, right, is the term used there, but we probably don't use that language. The needs, goals, conditions, and provision of services and activities for individual recipients assigned to the peer specialist. This is typically done one-on-one, but can also be done in a group setting. Skill building, problem resolution, and professional growth, those refer to the supportive and developmental guidance tasks that a supervisor provides. Sometimes those tasks fall into the supportive domain of supervision, such as supporting a person to resolve an ethical dilemma or providing peer support or a systems discrimination issue. Sometimes they're ensuring a person's career development needs are met, such as receiving adequate training and education related to the role. Supervision may also include aspects specific to the organization, such as following organizational policy or other administrative matters. Those are tasks related to the policies and procedures of the organization, ensuring that we complete the service provision documentation required by the grant or contract or organization or state, adhering to the laws and regulations that rule our services. Like we said before, we're here to support you all, but we set up a workforce development hub because your guys' needs are much greater than the few of us. In partnership with the UT Health Science Center in San Antonio and San Antonio Clubhouse, we've implemented a workforce development and support organization, PeerForce. It's a centralized coordination hub for peer specialists and family partner training and certification services throughout the state. Some of the services they provide include guiding peer specialists and family partners through that process, connecting peer specialists with supervision placements, providing financial assistance for training, certification, and recertification, expanding the capacity and sustainability of peer specialists, family partners, training entities, and peer specialist supervisors. You can find all of that at peerforce.org. And this is how we can help. We can provide technical assistance for organizations. We connect you to organizations that have successful peer integrations. And we do stakeholder engagement calls, monthly calls. Felicia has a certified family partner call, a CFP roundtable, and we also have a peer stakeholder call for the entire community. We want to advocate to advance the role of peer support and recovery across the spectrum of behavioral health services and throughout our community. We want to increase and access and remove barriers to services and supports for people. It takes all of us to make that happen. And so that's it for our presentation. Thanks for having us.
Now it's the questions. Now we really want to know the questions that you all have. So I will say something, just even with supervision, one of the things that we also want to make sure that supervisors are doing is you need to be doing ride-alongs with your staff, right? So if they're providing service, even if they're in if you provide it in the organization, supervisors should be going in there, also seeing what their staff is doing and how they're talking to people. One of the things that we find out, you never know until you pop up, right? And so even me and Bob, like, we're going to start popping up on trainings to see how people are doing in trainings. One, to assess, are you training what you're supposed to train? Because we get a lot of people that will sidetrack, will start training and saying stuff, and you're like, wait a minute. And we've heard kind of peers tell us that, say, hey, Felicia, my training seemed a little bit different than one of my friends' training, and they took it, and we took the same training. For example, if they could say, hey, well, I took the same core training, but like the information I received is different. Now we know that training styles can be different, and we know like every peer is different, and their style of how they engage with the individual could be different. So we're not talking about the style. We're talking about like the content and what are we telling families? Are we telling families, or individuals the based on our lived experience, what does that look like? And so I always do double, hey, as supervisors, we gotta do our quality checks as well. Just like anybody else has to do that as a part of their supervision. So I always say, just do ride-alongs if you can. I will say that Bob and I and our whole team, we are going to start doing site visits and start visiting people again. We know COVID kind of changed the game with that, but we're going to get out there and just meet people to see how y'all are doing, what's happening, what's going on. What are some of the questions? What are some of the barriers? Again, our role is to offer support. So we were in Houston last week And so we're going to be starting our roll around Texas. So we're trying to go everywhere from the panhandle all the way down to the valley. So again, wherever there's people, there's peers. So we're coming to a somewhere near you, wherever it is. We're trying to outline that for the rest of this year. So super excited to come out and see y'all. But what are y'all questions?
You guys have any questions for Bob and Felicia? Now's the time. We have their undivided attention.
Just one question about the lack of the chat button. So we were supposed to sign in on the chat.
We've got a list of all the participants that were here, so we'll send you the survey link here in a couple hours.
Thank you, darling.
Yeah, no worries.
I have a question,
Oh,
Felicia.
go right ahead. Go ahead.
So my name is Tracy Moore and I represent Anchoring Hopes. We are a peer-ran, peer-led, peer-based organization.
Mhm.
And so we want to create more opportunities for peers. And so we have just been given a contract with Harris County Juvenile Probation Department to implement a community engagement program using peers as credible messengers. So one of the things that we are running into is that the peers that are coming to us for employment, they have transportation issues, because usually peers, or because I know when I first became a peer, I started from zero. Like I didn't have, even though I had employment experience, I had lost everything due to a mental health crisis. So I didn't have transportation. I didn't have income. My only income was SNAP benefits at $194 a month. And so we're finding that with the peers, and then a lot of the people that we want to hire as peers, they're not trained. So I wanted to know, is there funding out there? Is there funding coming for peer-ran organizations to hire peers to support them with training? One of the things I'm looking at is once we get rolling, because it's a pretty decent contract. Once we get rolling and get money in, I'm going to buy vehicles as assets because I'm using the peers as mentors and credible messengers. I know that's a lot. I mean, I don't know if I said that effectively.
No, it's not. So I'm gonna dissect it a little bit, right? So I just want to make sure that I have heard you correctly. So your overall question is there funding for peer-run organizations, right? To hire peers. Okay, so typically the funding that we provide as far as the state. So yes, we do actually provide funding for peer-run organizations. We currently fund, I believe, 6 what we call consumer operated service providers, so COSPs, which are peer-run mental health organizations. So we currently do fund 6 of them today, as of today. Typically, our funding does not go towards an actual staffing. It goes to providing services. So typically, the funding that we give individuals is kind of what we call pass-through. So it's a pass-through, but it's specifically usually earmarked for service provision. So typically, HHSC will not say, here I'm giving you this amount of money and you can hire this many people. So typically that is not the case. And so most organizations, they diversify their funding so they're able to hire people and then use our funding, which again is usually only a small bit of most organizations. So we are only like, less than 10% of some of the organizations. Peer-run organizations, we may be a little bit higher, but again, it's typically used for the provision of services. So I definitely agree that there is an issue or a concern with how do we have money available specifically for people, right? For the manpower. So that is something that definitely we can look into. Again, that is a hard ask for state agencies, only because the way that our money comes in, it comes in from different sources, but typically, for example, I'll give you another example. We cannot pay for like hotel stays. We can't pay for food. State agencies can't pay for food at conferences. So there's some tangible things that typically either we can't pay for or typically we don't pay for. So employees salaries, typically we don't pay for that as a contractor as we're funneling out money. So that is something that, again, that we can look into to see what that would look like in the future. Again, it does depend on how our money comes in our kind of in the pot. If it's state money, if it's federal money, everybody has different requirements of what the money can be used for. So that is one. Second,
Okay.
it looks like you were talking about, and so one suggestion I would make is when we have availability to have the funding opened up. So typically, you know, people have to do a request for funding. So we have a request for proposals. So that comes out, that gets sent out to the broader masses. If your organization wants to apply, we encourage you to apply, right? And I know sometimes it is hard for smaller organizations, but there is a group of peer-run organizations that they are there and they provide some support. We also have the leadership fellows, not even leadership, it's a new name now. It's called POGO. Help me, Bob. It is Peer Organizational Growth something. Academy. Yes, I got it. POGA. All right. So literally they just changed the name. But that application went out literally just a few days ago, and we can make sure that you have it. But it is for like peer-run organizations to get that capacity, to help with that capacity building, because that is a huge issue. And so we want to make sure that we're uplifting peer-run organizations, because we don't want to have services only in the local mental health authorities or only in, you know, we want peer organizations to provide peer services in their community, because people are in the community and that's where they live. And so we'll send that information out as well, so people have that. And please apply. I think the deadline is November 1st. So you still have a couple weeks to apply for that if you would like to do that as well.
Okay,
then,
I will. And one of the things that we're trying to do here, Felicia, is we're trying to employ peers at livable wages. We're not trying to bring peers in at low wages, and we're trying to create a climate where your lived experience to us is like a bachelor's degree or a master's degree, you know. So like, for example, I have a master's degree in special education from the University of St. Thomas. But to me, my mental health peer specialist certification and my RAP facilitator certification and my peer supervisor certification, to me, is more valuable than that MS degree that I still owe the government $100,000 for student loans.
Oh no, we say that too. I tell people, the gift of my daughter gave me the PhD. And I'm like you, I got a master's degree. I was a therapist, I was a clinician, all of that stuff. But she gave me my PhD, and my PhD supersedes my lived experience, and your lived experience supersedes anything that anybody could tell you, because you're the only one that lived through it, right? Like, you lived it, you breathed it. I was, you know, whatever that is, that's your PhD. So we definitely encourage that and say that. So we're super excited about that, and we're still advocating for pay. That is a part of our advocacy, to make sure, again, livable wages. You know, and I tell people, if you're not even going Walmart standards, Walmart is 15, right? Like, that's the board. Like, that's like when you play cards, like, that's board, right? Like, I got bored. We should be upping that for folks. So we're definitely in agreement with what you all are doing, and we will continue to advocate, because that is what we do as well, advocate for livable wages for peers. And I think
we've got two folks with their hand raised.
Their hands up. Yep. Miss Burnett.
Yes, I just had a question in regards to CRU links. Are there any other links available for more CEUs? Because I already done my core training. I got my 250 hours. So I'm just currently working on my hours right now.
So we offer lots and lots. So I tell people, if you are not on my D list, you need to be on my D list. One, because we offer lots of CEU opportunities across the year, just throughout the year. I'll just shoot them out. So there's a couple of ways. We still, through the centralized training infrastructure, they have a lot of training availability that offer CEUs in there. And also remember, even if an organization does not offer a CEU, they may offer a certificate of attendance that can still be used as a CEU. So TCB will still most likely approve it if it is within the scope of work that you all do. I know because I did it myself for my certification. So they do approve it if it's within the scope of the role of what you are doing. So please, again, if it doesn't specifically say, hey, peer CEUs, because a lot of organizations will not have that, again, you can request a certificate of attendance. So many different opportunities. We also offer opportunities. We pay a lot of conference registrations. So there has been 4 that we paid out this past year. We will be at the Texas Association of Addiction Professionals this weekend in San Antonio at the TAP conference. And so we have paid for 85 registrations for that. They can use those CEUs from that conference also as well. Typically, we will have about 4 or 5 conferences that we pay for. TAP is one of them. The African American Family Support Conference is another one. Texas Council is another one that we have. And then occasionally 1 or 2 will pop up that will be like, oh, we didn't know. So let's provide scholarships. So the scholarship will provide for the registration only. Some of them are in person, a lot of them are still virtual, and some of them have both of the option to be virtual or in person. So we try to make sure that we give you those opportunities. But a lot of times after every email that I send, I will also send a couple of training opportunities in that email. So please make sure that, yes, there's tons of CEU offerings available. SAMHSA, I always say, if you guys can subscribe to some of the organizations out there, the SAMHSA website, if you just subscribe, they send out literally training stuff almost 2 or 3 times a week. Also the mental health technology transfer centers, those are really great organizations to subscribe to their D list because they offer trainings.
Okay, how can I get on your mailing list?
If you can just give us your email, then I'll put you on there. They're gonna give you my email. You can just say, hey, Felicia, this was me, and I just want to get on the D list.
All right, thank you.
And I think Sharon, you're next, and then Brett after that.
Hello.
Hello.
Thank you so much. I was so excited to hear about the provisional certification for people with backgrounds. That was news to me. And I had a lot of feelings about the fact that certain people with background wouldn't be eligible, and no one's doing PRSS training anymore. It's all RSPS. So I was really excited to hear that. And my question is there a limit on how long? I know they can't bill Medicaid, but nobody's billing Medicaid. So is there a limit to how long someone can have a RSPS provisional certification due to their background?
I'll let you answer that one, Bob. Yeah.
You can renew it every 2 years, just like the regular SPS, just like the Medicaid certification.
Yeah, so no, there is no limit.
Great, thank you so much.
Brett.
Hey guys, great presentation. Appreciate you. I have a quick, I guess it's a comment more than anything else. So I don't know if anybody else has brought this subject up or is talking about it or whatever else, but like, you know, I'm a certified PSS, right? And so I kind of grandfathered in. I, went the way of not having the degree, having the lived experience, also having the experience of being an RSPS for many years. Some of y'all probably know me. I've been around for a long time, so since the beginning of this thing, probably. So, my comment is this, or our concern. I don't know that I like very much that a qualified peer supervisor, or QPS as it says on the certification, for my pathway, it has to have some type of supervision by other people. No, I mean other people with other designations that may or may not have anything to do with peer work at all. May not know a thing about any of the qualifications, the work that we do, have anything to know. I mean, I've been fortunate enough, maybe hopefully to educate some of the people that, you know, maybe have some of those titles and things like that. You know, again, I know, like, for now it is what it is, but I just wonder if you know, if anybody else is bringing that subject up, or if anybody knows that maybe something can be done in the future to where you know, peerness is maintained, and, you know, a clinical supervision over peer work is not needed.
So a couple things. Yes, we've definitely heard that one before. So for sure. So we heard that one loud and clear before. And so I think there's you know, there's pros and cons to both sides of the story, right? So everybody will always have some sort of oversight. I think the issue is who has oversight and what their background is as far as having the oversight, right? And so I know that we'll probably continue to look at that as we're looking at all of our rules right now, you know. So we have specific times that we look at our rules to make sure, okay, is this still in alignment with what we're saying peer support is and versus what supervision is? One of the things that we do is we try to strongly suggest and have it a requirement in some cases that even those clinicians that are supervising the peer supervisors still need to go even through the supervisor training to know what it's like, right? So to do that and say, okay, I don't know a whole lot about peer support, but I at least got to know something about how to supervise somebody who is supervising peers, right? And so we're trying to do, you know, create some parameters around those spaces. Sometimes it is part of the contract. And so we're starting to look at all of our contracts that we're, you know, that we have out there to make sure, okay, is our contract in alignment with what we're wanting, you know, people to do as well when it comes to supervising, not just supervising, but also just even just the peer services themselves. So that is something that we're looking at doing as well. So, but yes, we definitely heard that loud and clear. We're trying to figure out also a way to create that career ladder to say, okay, we want our peers to go up that ladder. Again, we don't want them to have to be a clinician. If you choose to be, great, that's, you know, that's fine, that's your choice. But we don't want that to be mandatory. We want to be able to have peers supervising peers, but also supervising peer supervisors, right? In that order. So we're also looking at ways to do that as well. So there is that chain of command, but then that chain of command that, hey, they know what I'm doing, right? They know what I'm doing because either they've done it before or, you know, whatever that is. So I think there's multiple ways that we're trying to address that, but definitely we do know that is a point of contention. That is something even our team talks about all the time. We're like, okay, how do we do this? How do we make this, you know, how do we change the tech rule to make it make sense? And how do we not fight Medicaid in order to do this? Because a lot of it is tied to like Medicaid policy. And so we're just like, okay. And again, there's a fine tension, and we battle, trust me, us and Medicaid, sometimes we act like we're not friends in some days because we're like, what? But that doesn't make any sense. And what, can we take this out? And they're like, well, if you take this out, it'll fix this. And you're like, ah. So, but yeah, we are working on ways to even find, if there's ways to even find workarounds. We definitely have that conversation. And Elizabeth, you have a question.
So I have two questions. They're sort of kind of related. So to kind of piggyback off what Brett was talking about, from what I understand, the clinical supervision piece came into play because of Medicaid requirements for clinical supervision. That might be a whole nother brown bag session on Medicaid, or year of sessions on Medicaid. But so my question was, if an organization is not billing insurance, is not billing Medicaid, are they still required that their peer supervisors have clinical supervision?
If they're using this certification.
Okay.
Right? Because the certification is based on those standards. Even though they're not actually billing, the certification is based on those standards.
So if they're in the role as the peer supervisor and certified as a peer supervisor, then they have to, okay. My other question is if a certified RSPS works independently, hangs their own shingle, does their own independent peer work, are they required to have a certified supervisor?
So that would be outside of the scope of these rules and services, unless they're using this certification. Anyone who is using this certification is subject to the same rules.
Okay, so anyone that is putting themselves out there as a certified RSPS or a certified MHPS, then they are going to be required to stay within the parameters for that entire certification, all those requirements.
Right. Now, if they were using some other certification, because there are some that exist outside of the state endorsed certification, that's outside of our scope. So.
Okay.
Can't figure out how to raise my hand, so I'm just going to talk. But nowhere in the CERTIMI recertification process does it say anything about supervision. Zero. There's nothing in the recertification process on CERTIMI about needing to be supervised as an RSPS.
So
I've had an RSPS for 12 years, or PRSS and then RSPS, and I've never been supervised once. And I get it renewed just fine.
Well, in CERTIMI, you have to submit the, well, but let's see, you're grandfathered in, right? Well, no, but, okay,
No,
hang on a second.
I got both.
Or, okay,
But
so,
but nowhere in the recertification process is there anything about supervision.
right, I'm trying to think of, are you supposed to submit a statement in the application that you've met the hours by a supervisor or something like that? I'm trying to think about for recertification. I'm having trouble remembering for recertification.
Yep. You know, I'm looking at the website. There's nothing in there about certification.
There's not for recertification.
So you don't need a supervisor.
Well, no,
if
you're
just-
supposed to. The rules say
That
you're
doesn't mean
supposed
that you don't, yeah, that doesn't mean you don't need it though. So let us be very, very clear. Just because it is not written on an application does not mean you don't need it. That is something that we are working with TCB, because I think there's a lot of like policies that are not clear on the TCB side. So then people assume that it's the state's responsibility to do it. And we're like, no, because we're not the author of the certification. We just help do the curriculum. And so this definitely, we meet with the TCB staff, what is it, once a month, Bob? So we can put this down as a point to make sure it's clear somehow, because there are a lot of stuff that is not very clear on their website, and a lot of stuff that's not clear, like in a policy somewhere or anything like that. So definitely we can meet with them and write this down and say, okay, where is this located, or should this be clear so people can understand it?
So follow-up question. I was I've been working independently forever. Who do I get to supervise me? Because I was a peer support supervisor until CERTIMI lost my renewal 2 years ago, and I'm just not going to pay the late fees to get it again. But there's a lot of people out there who are not working for agencies and some of the agencies don't have supervisors in-house, and they don't know how to get supervised either. And how would an independent person go about supervision?
Well, that's a good question. The certification wasn't designed to be used that way. But that would be something that I've seen people use, align themselves with a recovery community organization or something like that. It's just one way.
I know tons of people who are doing it independently. So however it was designed, that's how it's being used. So just saying,
sure.
I want to make sure I'm staying in line with things, but as far as the renewal process looks like, it sure does look like I am, but not according to you. So.
And that's why we're here, right? So part of it is to clarify a lot of stuff that people don't, because we don't know how people get information. It is, our process is jacked up, y'all. We say it's like it's an onion. We start unpeeling layers of stuff. When we think we found something, we're like, oh crap, this is something else. Oh, we didn't know. People don't know. And honestly, that's why we want to make sure that we're on these calls and find these loopholes, because again, sometimes it's not with us as the state, it's with TCB. And then sometimes it's not with TCB, it's with the curriculum developers, or sometimes it's not with them, it's with, and so we're trying to navigate the different waters, and we don't know what you don't know, right? You don't know what you don't know until you ask the questions. So for sure, for us, we definitely, I wrote that question down. So I want to make sure that we touch base with TCB to figure out, okay, what is happening? What is going on? If there's a policy, if people are missing things, or if we're missing things and we're not interpreting it correctly, we want to make sure that we're right on point too. So this isn't about blaming or pointing the fingers or saying everybody is doing it wrong. No. We just want to make sure that people get the right information. So if there are questions, we can navigate those waters for you all and help support you in that. So please don't, we don't want to say that, hey, this is wrong. We're just trying to give you the information that we know at this time. And then again, we will take this back to TCB and make sure, okay, everybody has their own swim lanes. This is their lane. This is what they need to do. And this is how they need to assist. And I think there's 3 more questions up as well. Ms. Dickey.
Hi. So I guess just kind of, I'm glad that you clarified that, just kind of based on what he said. So I guess y'all will be getting back to us to let us know what that would look like if we RSPSs did need supervisors' letters to get recertified. Is that something y'all gonna get back with us on? Because
yeah, I mean we can ask the question and then I will send the response and then let Chelsea and Elizabeth forward that out to the group, because I want to make sure y'all get whatever response we have. We will definitely send it to them and then they can send it out to you all, since I know I don't have everybody's email addresses.
Okay, because I mean, yeah, kind of like he said, I've been RSPS for a couple of years now, and having to recertify. I know the first time that I ever got my PSS, I was afforded a letter because I had already worked those hours already with my a supervisor. So I didn't know that it was ongoing for certifications as well. So I guess that'll be something to just kind of figure out or whatever. So it's real good. Thank you.
So my other thought about that is it's potentially a gap, right? Something that should need to be attested to in an application. But
I don't think it's for recertification though. I don't know. I could be just right. I don't understand why it would be for, to constantly recertify, to have to get with a supervisor. If I don't know, that's just my thing.
Don't worry, we'll find out clarification to y'all. we will find it out. Cool. Trust me. This is why calls like these help us, because there's sometimes, like I say, we'll get stuff and we'll send it out, and sometimes we're like, oh, wait a minute, that's a good one. Like, let's write that down, and we can definitely, again, we meet with them all the time, and we will send y'all the answer.
And also, Peer Force can connect you with supervision.
Okay.
Yeah, you can get connected with a supervisor.
So we've got 3 more hands raised and about 7 minutes left. I just want to be mindful of the time. Dee?
Mine's just real short and sweet. I was just wondering if I could get Felicia. Is it Felicia? Is that how you say it? I did
it. Whatever. It's Felicia. My grandma used to call me Felicia. So yeah, it doesn't matter.
That's how they do my last name anyways. If I could get yours and Bob's contact information, I would like to reach out to the both of you if possible.
Absolutely. We'll make sure. I think Elizabeth is already going to do that at the end. So, yep.
Perfect. Thank you.
And John, I see your hand up next.
Yeah, I was just going to say, I heard some people asking about like financial assistance and helping people get trained. And, Peer Force has a financial aid sector where they do training vouchers for people trying to get RSPS or MHPSs. And then there's also, I'm an intern with the Connection Center out of San Antonio, and they're offering a scholarship for core training and for MHPS over there as well. So those are some different, options for people looking to get certified or get, additional certifications, really at no cost, and kind of wanted to throw that out there. Additionally, the Connection Center in San Antonio, they offer some Peer Academy stuff that comes with some additional training. It's kind of like, some do some self-study, and then you have some discussion groups and stuff like that. And I'm just now finishing up my hours with them, and it's been a really good experience. So anybody that hasn't done it in a while or wanting to kind of refresh, there's definitely some opportunities there, and there's even some funding available for like a stipend if you meet the criteria and get invited into their peer academy. So all good resources, and just wanted to make sure everybody was aware they're out there. Thank you.
Awesome, thank you. And Robin, I think your hand is next.
Right. So last thing, again, I'm going to talk about first episode psychosis and the as a family partner, and how we are supposed to, because I work with adult kids and youth and adult from 15 to 30. My concern is that anybody above 18 as a certified family partner, we do not, it's not part of our services usually, that age. And I know that we get, because we got a grant for this, but what do we do about that? Because it's not doing my part. I mean, I'm working with families, it doesn't matter to me, but it does matter to my certification that I'm working with adult family members.
Okay, so
yeah. Does that make sense what I'm saying?
So yes, but let me help provide a little bit of clarification.
Yeah.
So technically you can, again, the role of family partner is to see the family. So we know in first episode psychosis, you know, you can see the families of adult children because that is a specialized program. So that is like, you don't get penalized. That doesn't, you're not outside of your scope. That is a program, again, that is specifically for that. So our goal is to get the block. So, and I'll say this is the overall goal for all peers. So for whether you're a family peer or a mental health recovery, is to get the age removal outside. So not having age as a requirement. So that is something we're advocating for strongly. I know the community has been advocating for that strongly. Again, that's a whole process of what that looks like, but particularly for first episode psychosis, there is no age requirement for that. I mean, as far as you providing services, because you can't provide services to the adult families. Again, you should be providing services only to the family.
Yeah, of course.
Yeah, and not the kiddos. So same thing on first episode psychosis with peers. Peers should be, you can provide the services, peers can provide the services to those who are younger than 15.
Right, that's correct.
The issue only comes about age when it comes to billing Medicaid. That is the only issue, because Medicaid policy will not allow you to bill Medicaid for peer services for those who are under 21 currently. Right now, there is policy going through Medicaid to bill at a lower age. We're waiting to see if that goes through. There has been approval for that, but we'll see what that kind of initially washes out. Typically, the first ask was for 14-year-olds and up, and then the second ask was 16 and up. And so now we're seeing what the final ask will be. But yes, our goal is just to provide services through the lifespan. So that is what we are going towards. That is what we are hoping toward to do. That may take some time, but that is the goal for peers under the umbrella, is to offer services through the lifespan. So it doesn't matter what age you come in, it doesn't matter what age you go out.
Last piece I want to ask about. I hold both a CFP and an MHPS. I am currently only able to work as a CFP. What is the reasoning behind that?
Dual roles.
Dual roles, okay.
Yes, so that is something in the ethical policy.
Okay.
So both certified, yeah, because it gets confusing when people start trying to hire people. Get a 2-for-1 is what we call it.
Yeah, I'm not a 2-for-1. I only am working with CFPs. That is absolutely the end result of that. Right. But I had a MHPS. They kind of hired me after I already gotten my MHPS. That's the whole point. Okay, gotcha. Just needed clarification on that. Thank you so much.
Yep, no problem.
I know we have 30 seconds left. Can you repeat her question? Couldn't understand what she was saying about having 2 certifications.
Yes, so sometimes people will want an individual to do two different job performances. For example, if I'll just use her example, they may hire her to be a family partner and then also hire her to be a mental health MHPS. And we're like, no, that is two different roles and we want clarification. Hire her in the role that based on her lived experience, what she wants to do, not try to hire her for two different distinct, certifications.
Because a lot of us hold dual certifications.
Yes, you're more than welcome to do that, but whatever job you are in, you
Needs
need
to be
in that
specifically
role,
for
that
something.
one role, not trying to switch back and forth between.
Okay, because we do like co-occurring support, so I think that's why a lot of us have the dual certification. Okay, thank you.
But I'll also say, make sure you are adhering to the ethical guidelines of that certification, because a lot of them will address that issue of dual roles.
Okay, thanks, Felicia.
Mhm.